Good afternoon, everyone. So today I'll be speaking on the evaluation of the appropriateness and readability of ChatGPT responses to patient queries on uveitis. Oh, okay. So we know that uveitis affects approximately 2 million people globally, and uveitis, unilateral or bilateral, may lead to moderate to severe vision loss in a majority of these patients. To understand our paper, we must understand what is health literacy. Health literacy is the capacity of individuals to receive, process, and comprehend basic health information and services required to make wiser health decisions. Unfortunately, 43% of patients with uveitis lack sufficient health literacy. This is more so important in patients with uveitis as these patients require long-term follow-up, long-term compliance, and long-term treatment. A major challenge is the quality of the patient education material available online. An average US resident typically reads at or below the level of an 8th grader and sometimes a 6th grader. So if this is the thing in US, then we can only imagine the quality in India. So ChatGPT, as we all know, this is the era of AI, and it has been designed to generate human-like texts, enabling it to participate in conversation and answer questions. Sorry. Yeah. So if today I have uveitis and I ask Google what is uveitis, we see a variety of these websites like WebMD or like Mayo Clinic who answer some of these questions. However, today I can also go to ChatGPT and ask what is uveitis, and it would give me a response which is generated based on AI. So our study was pretty simple to compare the utility of ChatGPT from with these available resources. These are the 8 resources that we included, which included sources like AAO, Healthline, WebMD, etc. So we asked the around 7 to 8 questions like what is uveitis, what are the symptoms, how long would I need the treatment, etc. From these 8 websites uh, and to ChatGPT. The ChatGPT responses were two. One was the normal ChatGPT response, and the other one was with respect to a 6th grader comprehension level. We extracted this data and adjusted the font and size of text across all the documents to ensure consistency. The data was de-identified and assigned a unique code corresponding to each specific content for analysis purpose. This was presented to 3 fellowship-trained uveitis specialists. They graded these responses based on personal preference, comprehensiveness, and accuracy 1 to 5 on the basis of Likert score. These responses were also presented to Readable.com to globally accepted readability assessment charts. These are the statistics that we used. A total of 497 responses were generated, and these were presented to our uveitis trained specialists. So what did they say? Our specialists preferred the ChatGPT standard response from the available responses, both on personal preference, comprehensiveness, and accuracy. However, on the readability index, the one with the highest score was the easiest to comprehend. So what was easiest to comprehend was the gray one, which is the one which is according to the 6th grader response from ChatGPT. So so basically we say that ChatGPT provides comprehensive medical information with similar accuracy, but sometimes may demand a higher education level for comprehension. So providing a prompt with a decreased level of comprehension may help our patients which may have a decreased educational or lower educational level. So ChatGPT provides an avenue for patients to access customized, comprehensive, and accurate information tailored to their educational level. So what does it add? It is a step towards integrating AI towards patient education. It is capable of altering the responses according to the patient's level of education, and in future could help in addressing the discrepancies towards patient education. Big shout out to our team at Stanford, and we've recently been able to publish this in AO Ophthalmology. Thank you.
Very nice, Dr. Tanya.
Thank you, ma'am.
So, any questions? Anybody would like to ask anything from Dr. Tanya for ChatGPT?
Thank you.
We did some work on ChatGPT
Yes, sir.
in uveitis,
Yes, sir.
and we found that the ChatGPT is not the one human being is much more better
Human being. Yeah, so we actually compared with the available resources on online, like on WebMD and AO. So if I'm a patient and I search on Google, so this is what I usually, I find. So we compared that with the ChatGPT responses. Yeah.
How did you comprehend about the reliability of ChatGPT per se? Because many times the sentences are changed and the whole meaning changed. So
Sir,
before starting the study.
we asked like a simple question. Like we had a set of 8 questions that we put on Google, and the similar question was put on ChatGPT. So we were not actually altering our inputs. The inputs were similar, considering that if I'm a patient who gets uveitis and I put this question on Google vis-a-vis on ChatGPT. So that was the study.
Okay.
Tanya, I think ChatGPT does it reviews all the answers from Google and then gives a
Yeah, it is
comprehensive answer.
yeah. So it will combine maybe all
All
8,
the
but
inputs from
yeah, it would be difficult for me to go to all of those 8 and understand each and every what each and every
So the
website has to
patient gets
say.
a comprehensive review through ChatGPT
Yes,
from Google.
yes.
Okay.
I want to share one thing. When you will just staging the uveitis, so you have a one formula. You have to follow one method. But in the ChatGPT, they have to follow different methods, the different staging methodology and different.
So this
So
is
I think
not
so there is the for difference.
this
If you
is not
compare.
for diagnosis. This is just for as a patient. If I go and check, this is not for diagnosis or anything. There are other papers who have given patient scenarios, they've given history, they've given examination, and then asked the diagnosis. This is not for that. This is just for patient education.
Okay.